Hello, everyone, and welcome back to another episode of The Fourth Wave in Therapy. I'm absolutely thrilled today to have with me a wonderful colleague who shares a common interest with the Association for Comprehensive Energy Psychology. Dr. Alice Lee is actually one of their board of directors at the moment. But Dr. Lee is a holistic and integrative child, adolescent, and adult psychiatrist practicing in Stamford, Connecticut, beautiful part of the world there. And since 2002 has integrated functional and energy medicine techniques to pioneer new ways to safely support psychiatric medication withdrawal. So interested to dive deep into this today, Alice. Along the way, she became certified as a Reiki master, set a legal precedent for paving the way for holistic clinicians, and became board certified in integrative medicine not once, but twice. She's also written more than 258, it's probably more than that now, holistic articles. We have links to these below, and built a criterion-based energy testing approach to assess a patient's functional status. And she also has a podcast, which I encourage everyone here to listen into, called The Holistic Psychiatrist, and the link is below. So as I said, Dr. Lee is a board of director member of the Association for Comprehensive Energy Psychology, and obviously that has been part of her journey as well. She has lots of articles from them that she's written for them, and they are linked below as well. Dr. Lee, thank you so much for your time today.
Oh, thank you so much for having me. I'm really honored to be on your show.
It's fantastic. And maybe if I could just start with the most obvious question, which is obviously as a traditionally trained psychiatrist in the medical field, why and how did you end up exploring energy psychology techniques?
Well, energy psychology came very early as a holistic journey for me. I think very early on, my life experiences paved a way for me to be much more open to holistic approaches. In 2002, I was very gratified to find that there were clinicians ahead of me who had organized, the orthomolecular conferences, and I was able to meet with Abram Hoffer back then in 2002. But in 2003, it just happened that over a couple of days, somebody mentioned thought field therapy to me. And I thought, well, maybe it's something, important for me to know, because anytime something comes up, a couple of times within a couple of days, you're curious. Freezing, by the way.
Yeah, I just heard that as well.
Oh, yeah, you were freezing, and
Okay,
yeah.
you were a bit too. So we'll just maybe if you take it from the thought field therapy bit again. I don't know what happened there, but I seem to be back. Can you hear me?
But at what point did you notice that I was freezing?
Just the bit about thought field therapy. So just when thought field therapy came into
And
your
by the way, your voice is still kind of stuttering. Your
is
voice
it?
is.
Okay. Let me have a look because my internet is okay. But how's
Is
it sounding?
there something?
How's it sounding at the moment?
Uh, it's good. It's
Okay.
good right now.
All right. Let's put the energy field around so it all goes.
Maybe I'll stop waving my arm.
Oh,
I'll start with that.
fantastic. Okay.
Okay. Let's start over. So I learned about thought field therapy within 2 days of each other. The first time was when I was at a luncheon with a psychologist, and she mentioned that a colleague of hers had gone to a conference and she had seen someone overcome a phobia in like within 5 to 10 minutes. And the first time I heard that, it went in one ear and out the other, because as a psychiatrist, that's like somebody telling you that they saw somebody walk on water. It's just not something within my paradigm. at the time. Um, so then, 2 days later, by the way, Peter, you're frozen again,
Oh, I can hear you. It is saying
and
something.
I can't hear you talk.
Ah, okay.
Okay, okay.
Can you hear me now? I don't know why it's doing this. Can you hear me now? Am I okay?
Yeah. Should
Okay.
I just keep talking even? I can hear you now, but you're
Okay.
kind of like your
Staticky.
video and your audio is not in sync.
Yeah.
And also, should I just keep talking even though you're frozen?
Yeah, I can hear you.
I
So
mean,
it
did
sounds
you hear
okay.
me talking and it was
Yes.
okay on my end?
Yeah. Yep. It is. So maybe we just
Okay.
keep
And
going.
my video was okay, even though you might
Mm.
have been frozen.
Yeah.
Okay, let
Let's
me
keep going.
try to shrink your picture.
See
I'm
if
going
that.
to exit full screen
Yeah, and even
and see if that helps.
okay. And we
So
can
I'm going to shrink the video on my end
okay.
and see if that works better, okay? And
Yep.
I'm going to take out my video of my face. So,
Okay.
okay,
Perfect.
let me start over. Okay. So the question was, you said, okay, why don't you pose your question and we'll start from there.
Amazing. So, Dr. Lee, can you tell us, you've traditionally trained in psychiatry and obviously somewhere along the way, energy psychology medicine entered your world. Tell us a little bit about how that happened.
Yes, energy psychology happened back in 2003. And it was very interesting how it entered my life. At that point, I had just integrated functional medicine about a year before. And then I was at a luncheon with a psychologist, and she mentioned that um, she had seen a colleague go to a conference and saw someone heal from their phobia within like 10 minutes. And at the time, it just went in one ear and out the other because for a psychiatrist who's training traditionally, it's just not possible for someone to overcome their phobias that quickly. Um, and then 2 days later, I met Mark Botnick, and Mark right now is also on the board of directors. He's a secretary this year for ASAP, and he also used the words thought field therapy. And he was using it at that time in a mobile treatment unit. And I ran across Mark because one of my patients was too phobic to leave her house. And so she couldn't come to the outpatient clinic that I was working at. So I was looking for a mobile treatment unit who can go to her and help her there. And Mark just happened to be, I think, the director at the time. And so he was mentioning thought field therapy. And at that point, now I've heard it twice within 2 days. And I was very curious. I'm always very curious and very open to new approaches. And so I said, I'd like to learn from you about thought field therapy. And he came to my home and he showed me how to do EFT. And I thought, wow, this is really interesting. I really liked it because it was pill-less.
Mm.
And I was clearly able to learn from him how helpful it was. And so one of the earliest tests I gave him was my son at the time had a phobia, and he was afraid. He had this fear that he would be abandoned because he had a traumatic experience. And so I asked Mark to come to our home and help my son use and apply this technique to help my son overcome the phobia. And sure enough, in half the time that I purchased, he cleared the phobia for my son. And he was 6 at the time, and he was very skeptical at the time that it would help him, but it did. And so the second half of the appointment, Mark healed my son from a fear of the dark,
Wow.
which is very common in a 6-year-old, right? And so I started learning about EFT, and from Mark, I also started to get this idea that I might be able to use energy testing as one way that I could, access information. Because at the time, um, EFT was routinely using a scale from 0 to 10 to measure how well that technique was able to heal the problem. And so I wanted to be able to learn how to do energy testing as well.
Mm.
And in 2003, with Mark's guidance, I started to learn a little bit more about some of the techniques for energy testing. And so now I had energy testing and EFT from energy medicine, and then I had a growing knowledge about supplements from functional medicine. And as I continued with my journey, I kept integrating them together. The more I learned, the more I integrated. And at the time, my goal was to help my psychiatric patients to be able to be free from their need for psychiatric appointments. I wanted to help them get off their meds. I wanted them to heal underlying causes. And I had a very simplistic idea of what that meant at the time. Over time, with the ability to use energy testing, I learned a lot more about all of the underlying causes that we tend to put under one diagnostic kind of, I don't know, like a roof.
Mm.
And so if you call it depression, it might have a million different causes for depression. If you call it anxiety, there might be a million different causes for anxiety. And I was discovering that as I went along. I also compared functional testing with energy testing, and I was tweaking energy testing in such a way to meet my needs as a physician. And so I was comparing my results with the lab results. And it just so happened I was able to create a method that ended up being much more helpful for my patients than the lab results. So as I proceeded in my journey as a holistic psychiatrist, I started to veer more towards energy testing and using that as a skill to gather data, which was very helpful because energy testing is independent of distance, and also energy healing can shift biology very quickly. And so you can't just wait a week to see what the result of the energy testing happened to, show up in the biological body. So learning about energy testing was a very great boon to my practice. It was a really useful tool. And I kept developing everything, so you start with an idea, you start tweaking it, you start to check, the relationship between an intervention and an outcome through, muscle testing or energy testing the patient. And pretty soon I was kind of evolving very quickly in my holistic practice. But I would just say that even after, 23 years of being a holistic clinician, I'm still growing and I'm still learning, and the universe continues to challenge me with more and more difficult patients, patients who have protracted withdrawal and haven't been able to heal for years. Or, my last big challenge in 2023 was a patient who I helped get off 6 psychiatric medications in a year, and she was able to do it smoothly and remain well. So the universe gave me tougher patients than that after that. So it's just been always both a humbling experience to be a holistic psychiatrist, but also a very empowering experience at the same time.
I love this. This is amazing. Could we,
Oh, thank you.
in case anyone listening in is perhaps unfamiliar with energy testing, do you mean muscle testing or is it more than that? And can you explain a little bit about, for a newcomer, what is happening in energy testing or even muscle testing?
Well, one of the articles where I describe criteria-based energy testing is on my website under the medication withdrawal section. So you can go there, and it actually has an article that was published in a journal, and it kind of gives you ideas about what I do. I wish everybody knew how to do energy testing because it's so useful. Let's begin with basic principles. The first basic principle that I discovered in my journey as an energy healer is that my patients were able to respond with different energetic kind of conditions depending what was going on in their mind. So let's say if they were thinking 2 plus 2 is 4 versus 2 plus 2 is 6, they would have these different energy shifts. So they typically are strong with 2 plus 2 is 4 if you were to muscle test them, and they would go weak with 2 plus 2 is 6. They would be strong with a happy thought. They would go weak with a sad thought. They would be strong with the positive word. They would go weak with a negative word. And it was very clear that their energy was shifting. So I asked myself, so will this person shift their energy if I said 2 plus 2 is 4 in Chinese and they didn't know Chinese? Or if I said 2 plus 2 is 6 in Chinese and they didn't know
Oh,
Chinese?
interesting.
Yes, and I started checking it out in all my patients. And to my great amazement, everybody could do it. So if I were
What is
to write
happening?
out,
What is
yeah,
happening there?
exactly.
Wow.
Yeah,
Okay.
exactly. So at the time I was muscle testing everyone using their big muscles, like their big arm, and I would push down.
Right.
And they would be strong with 2 plus 2 is 4. They'll go weak with 2 plus 2 is 6. And I would give them a few directions. I would say, don't try to, second guess or think that I expect you to be psychic. Just hold out your arm as you normally do and listen to what I'm saying. And when you listen, hold as hard as you can with all of the 3 trials, and let's see what you get. Is it a strong? Is it a weak? And then what the other thing I did was I would write on an index card exactly the 3 things I would say in Chinese. And since my Chinese is very basic and rudimentary, I would say something like 1 plus 1 is 2, 2 plus 2 is 3, 3 plus 3 is 4, something like that. I would write it down on my index card. I would put it in away in my desk, and then I would say it in Chinese. Like I would say it in Chinese to my patient, and I would say 1 plus 1 is 2 in Chinese, and they'll just listen and they'll hold their arm really hard. And 99.9% of the times, my patients got it right. And then I would take out my index card and I would show it to them. I say, this is what I said in the specific order, and they would be all amazed.
Wow.
And the ones that weren't able to do it were the ones who got really anxious, performance anxiety. They tried to second guess what the answer was. So they weren't letting the tool show itself because they were interfering with the way energy was flowing through their bodies. So once I got this feedback from my patients that people do respond with this, shift, my next goal, and this is something I asked Mark Botnick, was, well, can I do that for my patients? And, are there different ways of doing energy testing other than someone pushing on your arm? And there's lots of ways you can connect a biomechanical feedback mechanism that shifts depending what your energy is to the energy state of your body. And so I started to learn different ways to do that. And now my way is like this. 2 plus 2 is 4, 2 plus 2 is 6. You can see on my fingertips that there is a biomechanical shift with an energy shift that correlates with my body. So if I say 2 plus 2 is 4, there's a magnetic-y kind of state of being that keeps that nail kind of stuck on the side of my thumb. And then if I say 2 plus 2 is 6, and I think that, it's slippery. Yeah. So there's an energy shift that manifests in the way in which this biomechanical feedback mechanism came through. Now, the next step was, okay, so let's say I can sense what is true and false, even if I don't know.
Yeah.
What can I do with this tool? And so the first idea I got, inspiration, you could say, was, okay, well, people who are doing EFT are using scales from 0 to 10. So maybe I can use scales, and I can create scales. And my very first scale was from 0 to 100, and it was for 2 scales. One was for absorption of nutrients, and one was for digestion of nutrients. And through that scale from 0 to 100, 0 being no digestion during a period of time, and or no digestion, and I didn't use time scales at that time. It was very experimental. So 0 was, no digestion, 100 is great digestion. And I was muscle testing and was getting this funny result that patients were getting really poor absorption and digestion when I was lowering their SSRI. Now, at the time, it was very early on in my holistic practice, so I really didn't know how to support SSRI, how to support SSRI withdrawal properly. Like, for example, nowadays I will use 5-HTP and check them for pyridoxal 5-phosphate, and I would like do all sorts of things now. But at the time, I didn't really know. All I knew was, whoa, they're not really absorbing and digesting the way they used to. So I used energy techniques, and I would, like work with EFT or set positive intentions. And the patients really did respond well to an energy medicine intervention. And so what happened was over time, it was probably a year or two after I realized that SSRIs and withdrawal interfered with digestion absorption, that I saw in a pamphlet written by Abram Hoffer, who was a pioneer in functional medicine or orthomolecular medicine about psychiatry. He wrote in his pamphlet that 95% or more of the serotonin system is actually found in the GI system. And that was when I connected something that was written somewhere and was known scientifically with something that I was observing with my energy testing. So energy testing became not only a wonderful tool like a lab test for my patients, but it became my mentor. It became a way for me to learn things early on, because you can't always rely on an encyclopedic knowledge about everything when you're just trying to learn as a holistic psychiatrist. When you're just beginning, you think that, oh, I can just use this, multivitamin mineral and everything will be cured with it. Or you think, oh, I can just use EFT and everything will be okay with that. But with energy testing, you start to understand, how do you integrate what's happening with the patient's body when you lower a medication. In time, I ended up with what I call the complete analysis. It was 45 pages long. It had thousands and thousands of data points and many, many scales and tables of scales. And out of that 45 pages, I picked the best questions that I was using the most frequently. And I started phase 2 of my complete analysis. I started off with maybe 10 pages of very relevant questions and scales that I had created. Now it's, again, about 25 pages, maybe 30 pages of different scales that I've found useful and created, which is really great because in energy testing, you can create things out of thoughts and words, and you can make scales quickly. Whereas if you had a mechanical lab test, it might take 10 or 20 years before you can have that idea manifest at a physical level. So just like, we can get data about objects from Amazon, which is, where you can go online, you can buy things here in the US. And so you can go there and you can say, okay, the dimensions are this, this is what it does. Here's a video about it. You can get all the data, and then you can give it, your data-driven credit card. None of it is real. The money isn't real. The object isn't real. It's just showing up in your computer. But sure enough, after you pay for it, the next day you can see that physical object arrive, at your doorstep.
Yeah.
And in energy medicine, energy medicine, everything is virtual. Everything is basically information-based. You're using information to support the ripple effects of how that information has an impact on biology. And so it's really exciting when you have that tool, but also you have to respect, not only is it powerful, but it also has limits. And so you start to learn, where does it, where are its boundaries? How can I use the functional medicine optimally? And how can I use energy medicine optimally? And where do the limits of my current level of expertise end? Because even at this level of my expertise, sometimes I think, well, maybe this patient needs additional clinicians like an acupuncturist
Mm.
or a chiropractor or have neurofeedback or maybe another therapist who would have more time to discuss therapeutic issues with the patient. So despite the fact that I can juggle a lot of different fields, patients um, only have an hour, with me each time. So you're still limited.
I love that analogy of the whole Amazon thing. It's a bit like Wi-Fi. It's the whole Wi-Fi bit as well, isn't it? It's kind of like, yes, you do this thing online and magically the product appears in the doorstep. And how did that happen? Yeah, I love that analogy. It's fantastic. So tell me,
By the way, I just got a book recently about quantum computers that will be coming out in a few years, which are going to be thousands and thousands of times faster than our
mm,
silicon-based computers.
mm,
So, as amazing as energy medicine might be, and we're using computers to kind of explain its phenomenon, um, I think that once we have quantum computers, maybe we can be a step closer to
mm,
understanding energy medicine and
yeah.
the quantum field and how we use thoughts as quantum energy to shift things. So,
Absolutely. Which
mhm.
it does bring me to the question, because of all of your experience in this space and your medical knowledge, do you think the energy testing part has been missing from modalities such as thought field therapy or EFT, if we were just strictly talking about the application of tapping? Do you think the energy testing part is a necessary component that perhaps, should be included because it gives you so much more information than just that, client's subjective unit of distress rating out of 10 or something? Like, it seems like it's wrapping around and accessing other information, particularly that bit about saying the, incorrect sum in Chinese and yet the body is still picking it up. Like, is that
Yeah.
something that you're noticing or wish that the whole training field kind of included?
What a wonderful idea. I never really thought about it in that way. But I think it would be very useful. The reason why is because there are so many techniques out there. And it would be very helpful, actually, not just to learn how a patient heals using a technique, going from 0 to, let's say, 10. You can use any kind of scale, really. But if you can use a scale and access information neutrally as a clinician and learn that skill, and you're able to compare, okay, I learned logosynthesis, I learned Reiki, I learned this or that. I'm going to treat all these patients that are similar with these techniques for a specific problem. Which one of these techniques actually make the most difference? You can literally, or you can use energy testing to figure out, okay, I have this problem. Which
Mm,
of these techniques that I've learned in my little basket of energy tools is best for applying it
mm,
to the
yeah.
patient in this situation? The more you are able to question and get answers through an energy testing approach, the more I think, number one, you'll be able to know like which techniques are best, when to use it, how to use it, which patient or client might benefit from which tools. And it can, like as a therapist, that might really help smooth things out. Um, and it may also move the field of energy medicine forward quickly
Yeah.
because as long as we can compare different techniques, we can start to see, oh, wow, this technique was really effective, or this technique, you should not use that technique in this way.
Yeah.
Here's an example.
Mm,
Um, One of the things I discovered about energy medicine is that for some very fragile patients, when you do energy medicine, and this is where it's somewhat limiting, and you never imagine that energy could do this, but the more you try to heal someone, the more you're putting instructions in the body to do certain acts of healing. And if the person doesn't have the physical wherewithal, the physiological mechanisms in place to do it, what like healing stressors or a healing crisis. So it's only do with decompensating. And what I've learned is that people can decompensate because they are receiving the energy and the instructions, but they're not able to do the work inside their body.
Mm.
And when I used energy testing to measure those 3 days after they applied a lot of energy work to see what's going on in the body when a patient reports a 3-day period of what they call a healing crisis, which might be more fatigue or anxiety or sleeplessness, I see at least one component, which is that nutritional status went down and it went back up at the end of 3 days. So whatever the energy was trying to do, it was trying to do it, but there was not enough nutrients to do it with.
Mm.
So
Mm. Yeah. Yeah, I got that in the end. Yes. Yeah. Can you hear me?
did you?
Yeah.
Okay.
Yeah, yeah.
Yeah, you were frozen for a while,
Yeah.
but I just
Oh,
kept
good.
talking.
And it makes sense, doesn't it, with what you said about what is known in psychiatric medicine about the impact of those medications on the gut microbiome and the GI kind of system, that the whole kind of link to the nutritional, yeah, I guess, system in the body and the efficiency of that is actually improving as that energy shift happens. Um, I mean, Dr. Lee, how have you
Mhm.
found the embracing of energy medicine in psychiatry amongst your peers or your colleagues?
Well, I think in general, psychiatrists like to stick with functional medicine because they're more conditioned to work with physical pills, right? They're they
Absolutely.
want data that they can hold and measure. But certain energy techniques can make a huge difference. So yeah, it is becoming more accepted, but you have to realize, it's scary for a doctor to use energy work because they could lose their license, depending on where their, medical board is in their state,
Mm.
because energy medicine is, just considered more out there, woo woo to it.
Mm. Yeah, absolutely. And advice to anyone listening in, obviously, to explore what is the license boards in your area as well. I mean, what do you hope,
Mhm.
Alice, what do you hope the future holds for perhaps holistic psychiatry, patients, obviously medications such as antidepressants, like we've talked about? What do you hold as hope for the
Mhm.
future?
I really hope that the future will destigmatize mental illness and take it out from this shameful place where patients bear the burden of psychiatry ineptitude. True.
Mm.
It is not true that mental illness is just your brain, you know, misfiring or a chemical imbalance with your brain. It's not true that somehow subconsciously you want to be sick and therefore it's showing up as a mental illness. So there's a lot of myths about mental illness that I hope will be swiped away in the future and people won't feel stigmatized. And I
Mm.
think when you're feeling stigmatized by the label and you feel like it's kind of a doom, doomed kind of label that you can never heal from, I think it creates a lot of isolation and hopelessness. Sometimes anger, sometimes depression, but sometimes people who aren't well treated in psychiatry end up, doing these, the mass shootouts and
Yeah.
things like that because they don't have any hope. They are isolated.
Yeah.
But the most important thing, I think, when we get to that place in the future is I hope that someday people will be able to heal underlying causes of mental illness and stop calling it depression. Instead, it could be a liver issue, it could be an infection, it could be a combination of genes and enzymes. Whatever the underlying cause, let's not just put a label, you're depressed, as if that describes everything. And now we're going to give you a medication for a symptom rather than an underlying cause. So that's my goal, to plant the seeds as a holistic psychiatrist that someday in the future, the benefits of our enlightenment will be able to really be felt by patients who have been waiting for this field to evolve for a long time and who have really suffered because we have been pretty stubborn about our paradigm.
Yeah, yeah. Totally agree. And I am just thankful for people like you in our world who are absolutely, pushing this forward and really showing from a data point of view as well how these approaches can work. So, just from my small corner of the world to yours, thank you so much for the work that you're contributing in this space, and every patient obviously benefiting from this. Dr. Lee, everybody. And all of Dr. Lee's articles are below linked, as well as her podcast and all those articles that we talked about, just so that you can explore a little bit further. And of course, you may be inundated, Alice, with requests now. So thank you so much,
I hope
everybody.
so.
Thank you, everyone, for listening
Thank
again. And I hope that, yeah, you found a gem there that really, might just sort of expand your own thinking as well in this space. So we look forward to seeing you on another episode, everyone, of The Fourth Wave of Therapy.